Welcome to Healthy Kingston. I'm Janet Wade. I have some wonderful news for the residents of Kingston. Our COVID numbers have gone down dramatically. As of the 24th of February, they are now 32, which is wonderful. We have vaccinated 336 people with either the Pfizer or the Moderna vaccine. And there is another clinic that will be coming up on Saturday, March 12th from 9 a.m. to 1 p.m. at the Kingston Intermediate School. And as many of you know, you can go ahead and register online on the town website at www.kingstonma.org. You can certainly call as well. Children definitely need to be registered. Because we need to make sure we have enough of the vaccine. There are walk-ins available for adults. So good news for all of us. And also the Board of Health has rescinded the restriction of masks on the town hall. So again, masks are gradually working themselves away, which is great. Today we'll be concentrating primarily on the second leading cause of death in the United States, death and disease, and that is cancer. It's only preceded by heart disease. And fortunately, we have a local woman, Christine Saba, who's a nurse practitioner. She's also a doctoral candidate in nursing practice, and she has worked extensively in oncology, and she will be speaking to cancer signs and symptoms in men and women, as well as current treatments, and advocating for yourself, and advocacy for cancer research and finances, and also the current treatments that are available. So I feel very fortunate that we have a local resident who is so well informed on that topic. So with that, I'm going to introduce Christine Saba. As I mentioned, Christine is our local Kingston expert on oncology, and she's worked 15 years in oncology itself, but she's also worked adult med surg, IV therapy, community health, ICU. So she has extensive experience, medical experience, as well as in the field of oncology, in which she's working in radiation oncology right now. So again, Christine, thank you very much for being here. I really appreciate it. And let me ask you, right now in the United States, common signs in men and women of cancer. When do you think people should sit up and take notice and be concerned?
Yeah, that's a great question, Janet. For a lot of patients, one of the earliest signs that they may see, both in men and women, is an unexpected or unanticipated weight loss. Now, most people will say, well, gosh, oh golly, gee, I'm not unhappy to lose weight, but this does become a concern for people when they aren't trying, they haven't changed their diet or increased their exercise. And, it becomes noticeable in their clothing and in their face. That's really an important symptom to talk to your provider about. Mm-hmm. In women, any unexplained vaginal bleeding, of course, any discharge. For both men and women, a loss of appetite or a change in their appetite certainly can be some concerning symptoms for both men and women to discuss with their providers. Also, unexplained lumps or bumps that people notice in the breast area, soft tissue area. You certainly want to bring that to your provider's attention. Any new onset of symptoms like indigestion that comes on rather suddenly, that isn't responsive to just changes in diet. You certainly want to discuss those things with your provider. Mm-hmm. So those are some of the more common symptoms that both men and women experience.
From your experience, have you seen like fatigue, bleeding, any kind of discharges?
Yes, so for women, vaginal discharge, of course, any discharge from the breast, new lumps or bumps. Fatigue is of course, a concerning symptom, but not only for cancer, for other things. I oftentimes will have patients present with fatigue that actually happens to be related to a change in their thyroid function, or could be some anemia, and so definitely needs some follow-up. But yes, those also are symptoms that can occur for both men and women.
Yeah. Well, and as nurses, I know you would agree with me. Some of these are somewhat vague, or they could be representative of a lot of different diseases or health issues.
Right.
So even more important, to go and get them evaluated and not to
Really,
just come to conclusions.
Really
Yeah.
good point. Yes, definitely. They shouldn't be dismissed at all. And you should really talk to your provider. Everybody's situation, of course, is different. Everybody's history is different. And
Right.
I wouldn't want someone to just dismiss them.
Right. So cancer in men, any particular cancers that are specific to men?
Yeah, so the most prevalent cancer in men, most common, is prostate cancer. The numbers in the United States top over, 180,000 to 200 new cases a year. And that's followed closely by lung cancer. Although the numbers are starting to improve as people are quitting smoking. Unfortunately, we have younger people now that vape or use the electronic cigarettes, and not a lot of good early data yet on that. So for men, it's prostate cancer, lung cancer, colorectal cancer, of course, is not uncommon in men and women. Bladder cancer also commonly occurs in the United States in men. There's some factors that will lend itself to some people being more at risk than others for some of those cancers. Certainly goes without saying that smoking is contributing to not only lung cancer, but can be a factor of bladder cancer. For both men and women, if you're smoking, you should really try hard to stop.
Right.
The American Cancer Society has many good resources for people in that regard.
Right. I do know at one point testicular cancer in young men was becoming an issue. Do you still see that as the case?
Not nearly in the numbers that we once did.
Oh, good.
Yes.
Good.
Yeah. Yep.
What would you attribute that to? Maybe early detection, or?
I think early detection, and I think there's just been a lot more awareness for young men in high school, young adults, and in the college setting. I know a lot of local colleges have done a really good job of educating people about testicular cancer. I do think that people are more aware of it, and it's detected earlier.
And women. I mean, we always think of breast cancer.
Yes, breast cancer definitely for women, of course, and lung cancer as well. It's interesting, the lung cancer numbers started to increase a couple of decades ago, and a lot of people attributed that to women, working, being in the workforce, and some of the habits that came with that, in the workforce. Colorectal cancer is also common in women. We know that there are several great screening tools, age-specific screening tools for colorectal cancer. Nobody jumps up and down about having a colonoscopy. I know that, but you should talk to your provider. There's a couple of different methods out there for screening. Endometrial and uterine cancer, also common in women, and thyroid cancer. Thyroid cancer in women between the ages of 25 and 65 is not uncommon, but the good news with thyroid cancer is it's highly treatable, and we enjoy some good outcomes with that.
Okay. What about ovarian cancer? Have you seen much of that?
We do see a lot of it. It's we tend to see a little bit locally advanced ovarian cancer. We don't have great screening tools for ovarian cancer. Most people notice bloating, stomach discomfort, again, vague symptoms of fatigue. And so, regular checkups with your provider, GYN provider, is very important.
Can you speak to, I know I've worked with teenagers and a lot on sexual health and having multiple sexual partners, and certainly the importance of protection, but also the higher incidence of cervical cancer. Are you seeing much of that?
I am, and HPV-related cancers, not only cervical cancers, but unfortunately GI-related cancers that are attributable to HPV. We have great screening for women for HPV via the pap smear, and young girls should start that at the designated screening ages for themselves. Knowing your partner's health, of course, and your partner's history, unfortunately, is a difficult conversation to have, but young people should have that. And of course, using protection. Just following, safe sexual practices for both men and women is really important.
Right. Okay. What are you seeing as far as treatment trends? And I know that's a wide open question, considering all the different types of cancer and how the treatments can be very specific for specific types of cancers. But, particularly being in radiology, what do you see as the trends out there, and particularly going forward? What can people expect?
Luckily, I've been privileged enough to be in nursing, and I've seen great improvements, great strides in treatment strategies, and many more options for people. When people see an oncology provider, they will be offered, generally speaking, combination therapy. And that combination therapy can include chemotherapy, it can include surgery, and include radiation therapy, and now immunotherapy, where we use the body's own immune response to attack the cancer cells in its simplest form. For radiation therapy, we use radiation therapy oftentimes in conjunction with chemotherapy or following surgery. We will also use it as a debulking technique. In other words, if somebody needs surgery for a large sarcoma tumor, for example, they may have high dose, intense radiation therapy preoperatively in an effort to kind of shrink that tumor a bit, so that surgically it's a much cleaner extraction. So radiation therapy, generally well tolerated by folks. It's kind of a slower on side effects. Most people tolerate it with some supportive measures, but it's used very widely across many cancers.
Okay. What I also wanted to mention is you mentioned you've seen a lot of progress. I know over the years, cancers that were very lethal are now, you can live with them, you can recover from them. Can you speak to that at all, in any particular types of cancer that you're seeing a lot of progress in treatment?
I was just remarking to a colleague of mine that, when I first started on my nursing journey many years ago, we would never see a patient, in their 70s, much less their 80s, coming into an oncology center for treatment. So people are, in fact, living much longer after their cancer treatment. Some of that with, for survivors, there's still a lot of work to be done following treatment. They need ongoing surveillance and monitoring and follow-up. And some people following their treatment from their disease, be it chemotherapy, radiation, or surgery, are left with some side effects that are, unfortunate. So we've made great strides. I think we're starting to see, great benefit with some of these therapies for our lung cancers. Pancreatic cancer is an area of undergoing a lot of research, and people are really hopeful for better outcomes for people with pancreatic cancer. It has traditionally not had that. So I'm really hopeful for the future.
Wonderful. And I know breast cancer So I've had unfortunately, a number of friends, a number of women I know who've gotten it, but it's not the bleak sentence that it was many years ago.
No, it's not. That's a really good point. Yeah.
Yeah.
It's
Yeah.
true.
They're doing tremendously well, particularly with early detection and important mastectomy of
Mammograms.
Right.
Mammograms.
Families. We can't talk about this without bringing families into it. What type of support is out there for families and advocacy for patients and families?
Oh, there's a great deal of support out there. Certainly living in the surrounding Boston community, we are so fortunate to have as many institutions as we have, all with terrific resources attached to them. I generally speaking, refer to the American Cancer Society website. I think, their research, working with NIH, their information is well researched and well thought. They have a number of resources for people, from transportation to supportive services throughout the course of treatment. Certainly in the Boston area, we have Hope Lodge, which provides temporary housing for people that are undergoing treatment in the Boston area, who live far away and for whom commuting is just too much. So there are a lot of supportive services out there.
You're right. And I know there's a cancer support services community on the South Shore, and it's in Norwell, and also the cancer support community services of the South Shore. So people can refer to those. Also, just to keep in mind, not only for cancer, but unfortunately, during this time of COVID, a lot of people are going through grief and grieving. And we're talking about adults, families, children. And we are very fortunate to have a program, Hope Floats, right here in Kingston at 4 Elm Street, and at 781-585-4221. And anyone who's in the process of grieving a loss or just going through a difficult time due to a disease, be it cancer or something else they might be going through physically or emotionally, Hope Floats is a wonderful resource for all of us. So with all of that said, Christine, any words of wisdom you want to share with us regarding cancer and cancer detection and being aware?
I think it's really important to advocate yourself when you're seeing your physician. Make sure that you've done your research. The one thing I always tell people, I get inquiries from friends and family and neighbors all the time. If you're going to be seeing a provider and there's, you have some great concerns, make sure that you bring somebody with you, a second person, and, take some time ahead of time to write down your questions, bring a notebook, and perhaps have the second person take notes for you. I think sometimes it's very overwhelming in the confines of a visit with a provider. There's a lot of information that's shared and it's difficult to process it all. So having somebody there to sort of listen and take notes for you. I think everybody should listen to their body. I think they know their bodies the best. They know when something has changed. And, don't be shy about leaning on your support system. It amazes me how many times patients, they get a lot of, well-intentioned inquiries about how can I help you? What can I do? And people don't actually reach out and say, this is what I need. So I think it's really important to do that. And never settle for treatment that you're just not comfortable with. Ask more questions, certainly seek a second opinion. And coordinate your care. Sometimes it's easier to stay within one healthcare system. I think navigating sometimes amongst different healthcare systems can become burdensome and overwhelming. So, just try to think about that. What's going to work best for you?
Excellent information that we all need and needs to be repeated, and goes across the board for all healthcare services.
It certainly does. Yes.
Yeah, absolutely. Well, Christine, thank you so much. Continued success with your work and your doctoral program.
Thank you so
you
much.
are one of the angels among us working in oncology, that's for sure. Okay.
Thank you, Janet. It was a pleasure to be here. Thanks for having me.
Take care. Bye-bye.
Bye-bye.
So I hope you found the information today beneficial. Please do keep in mind COVID immunizations. It's certainly never too late. We get very excited when people who haven't been vaccinated do start the series. And those of you who haven't been boosted, please keep in mind that even though the numbers are going down, it's still very important to get the booster. And I know it's pretty much gone through my family, and several of them were ill, but the fact that they had had the booster certainly diminished their symptoms considerably. So that's definitely something to keep in mind. Our next clinic is March 12th, 9 to 1, Kingston Intermediate School. Also, keep in mind all the good information we received from Christine Saba about looking for signs and symptoms of cancer, but anything unusual, you know your body and what doesn't feel right for you. Doesn't necessarily have to be cancer. It could be a number of other things, but it's certainly important that it's checked into. And so with that, please stay safe, stay healthy, and we'll see you next month.